So Crystal, today we're going to be doing a postural assessment. Have you done one of these before?
No.
No? Cool. For yourself and me as well, it's important that I assess your static and dynamic posture and your functional range of motion. Posture is the term used to describe the relative arrangement of the parts of the body. As I'm sure you know, static is when you're stationary and dynamic is sort of when you're moving. Therefore, I'll be looking at your posture while you're moving. Standing and sitting still. Things I'll be looking for are muscles that are lengthened and weak and muscles that are shortened and tight. By noticing and observing them, I can then adapt your training program to include stretches for tight muscles and strengthening exercises for weak muscles, and also assess if there are any serious issues that may need to be addressed or referred on to someone else. So I need to tell you that I'm not trained to diagnose muscle imbalances or dysfunctions through specific muscle testing, but it is a major help if I and we can identify things where there might be a problem. That way I can then be able to refer you to an allied health professional like a chiropractor, podiatrist for more diagnosis and a treatment plan.
Okay.
So in order for me to look for any issues, we need to use a screening tool. The one I'd like to use is a range of motion test, which will help to assess your active range of motion at a particular joint. The test is quick and easy, and it's easy to administer. It involves you standing in anatomical position and slowly moving limbs in a number of planes around each joint. This will allow me to estimate the range and compare it to normative data.
Okay.
Cool.
Okay. Yeah.
So I've read through your pre-screening questionnaire, and in part A it looks all good. There's no family history of illnesses. You exercise. You keep active. You're not on any medication. You're not pregnant. That you haven't had recent births or any current diseases. So that's awesome. But I do see here that you've circled muscular pain. Would you be able to tell me about that?
It's just on this side, on the left side, and it's about from there down to there.
Okay, right. And have you been to see anyone about it?
I've seen my GP, and yeah, he said it's all good.
It's okay.
All,
So
all clear.
you've submitted a medical clearance.
Yes.
And all of that.
Yeah.
Cool. That's great. That means that you can still continue to come to the gym and keep training to your current program. So that's really good.
Okay. Cool.
But first, what I'll get you to do is to answer a few more questions just about your lower back. So out of 10, 1 being like no pain at all, 5 being like sort of a constant niggly pain, 10 being you're stuck in bed, what rating would you give it?
About a 4.
A 4? Okay, and sort of do you feel it most of the time, or?
Not all the time.
No.
It comes on like every couple of days.
Okay.
And it might be there for half a day. It's not always there. Yeah.
Yeah, cool. And do you think it has any relation to maybe what you're doing with work or exercises or anything like that?
No, I haven't really related it to anything.
Okay, that's cool. Alright, well I'm happy that you're not in heaps of pain, but any pain is no good in my eyes, so we're going to try our best to fix this problem area. So you said it's more on the left side from about up here, is that right? Yeah, cool. So it's definitely in your lower lumbar region, and that's good because we have lots of exercises and lots of sort of stretches and things that we can do to strengthen and stretch that area. It may need loosening or it may just need strengthening. It's a common area for people to incur pain, but yeah, there's lots of techniques that we can use to help fix that.
Okay, cool.
At this stage, there's no major contradictions or risk factors regarding exercise or the current plan that you're on regarding that sort of injuries. So for now, we can continue as per usual. So just so you're clear, we're going to do this thorough check to ensure there's no major underlying issues that we need to be more aware of, and yeah, we'll try our best at preventing future injury. Cool, so let's get started on your postural assessment.
Right.
Okay, Crystal, so what we're going to do now is your range of motion at all of your major joints. I'm going to get you to stand in the anatomical position with your palms facing forwards. I'm going to get you to bring your left arm forward and up towards the ceiling as far as you can without rotating your body. So keep your chest forward and hold that position now. And relax. So standing in the same position with your palms facing forward without moving your torso, take your left arm back behind your body, keeping your arm nice and straight. Just relax your shoulders and relax. Okay, from anatomical position, I'll get you to turn around and face the opposite wall so we can now do your right arm. So eyes facing forward, palms facing forward. I'm going to get you to take your right arm forward and up towards the ceiling without rotating your torso or chest. Keeping that palm of yours facing towards the rear, and you can relax. Now you can take your right arm back behind the body and relax. Now I'm going to test your trunk flexion. Stay in that position. I'll get you to tuck your chin to your chest and you're going to slowly roll forward until your fingers are touching the floor. Just relax your neck. Let it drop. And your shoulders, relax those, and your spine. Deep breaths. And hold the position. Nice and slowly come back up to standing position. Okay, now I'll get you to go down onto your back. And we're going to look at your hip flexion. So I'll get you to put your feet out. Yep. I'm going to get you to lift up your left leg to the ceiling, nice and straight. Point the toes, that can help. And relax. And now your left side. Bring that leg as close to the body as you can. And relax. Alright, now I'll get you to flip onto your stomach. So we're going to get you to test your hip extension. So hands by your sides, yep. Focus on pushing your hips into the floor. I'm going to get you to lift your right leg off the floor, keeping the leg nice and straight. Make sure you push that right hip into the floor. And relax. And now your left side. Try and push the left hip into the floor. Push that hip down. And relax. Alright, from here I'll get you to bring your right knee to your back side. As far as it can go. And relax. And your left foot to your back side. And relax. Now I'm going to get you to lift your chest and your shoulders off the floor. Nice, so stay on your stomach, arms by your sides, flat. And then just lift up, lift your, yep, like that. Perfect. Pushing your hips into the floor. This is testing your trunk extension. And relax. I'll get you to lift your left foot off the floor so that your foot is parallel to the ground. And now I'd like you to point your toes so that your foot is plantar flexed. And then back to neutral, parallel to the floor. And now I'll get you to pull your toes back towards your shin in dorsiflexion. And now you can bring it back to neutral. Now I'll get you to swap your legs over. So raise your right leg from the floor so it's parallel to the ground. Now point your toe in plantar flexion. Now take your foot back to neutral so it's parallel to the floor, and pull the toes back towards the shins in dorsiflexion. And back to neutral. And relax. So thank you, that is your postural range of motion test complete.